Computer, yes. Okay. All right, so we're recording. So my guest today I'm really excited about chatting with is Dr. Jessie Dreyfuss. Patients know her as Dr. Jessie. And before we get into all things holistic vets, let's hear a little word from our sponsor, which is Sunny's Goldens, first and only line of supplements specially designed for the unique needs of golden retrievers, and showing it here on the video, loaded with 10 human grade ingredients, and these are very superior ingredients. I'm a very health conscious person myself, so I actually put my money where my mouth is and actually will eat one of these right here on camera, because it's loaded with 10 different human, what we would call superfoods: chlorella power, L-taurine, organic alfalfa leaf juice powder, BCM 95 curcumin, which is the most premium and bioavailable form of curcumin on the market, all specifically designed for the unique needs of Goldens. So listeners can go to sunnysgoldens.com and use the code PODCAST to get $10 off their first order there. All right, Jessie, let's get into it now that the commercial is out of the way. So Dr. Jessie Dreyfuss, aka Dr. Jessie, is a certified holistic veterinarian in Fort Lauderdale and owner of Healing Paws Center. That's healingpawsfl.com. She also has her own personal page full of articles and helpful videos, many courses coming soon, and that will be at Jess, petvet.com. Again, our patients know her as Dr. Jessie. She's an expert in providing pet owners with all sorts of unique holistic therapies, such as pet acupuncture, rehab, physical therapy, nutrition, herbal medicine, and a host of other holistic therapies like electro-acupuncture and hydrotherapy. Right now, you can go to healingpawsfl.com and get Dr. Jessie's monthly e-newsletter, which includes awesome tips like 10 awesome holistic remedies you can do at home for your dog. So Dr. Jessie, welcome.
Hi, thanks for having me.
So why don't you fill in anything I may have missed right there, and we'll get into your story and all about what you do for our awesome canine friends.
Yeah, I mean, I think you covered a lot of it. I am certified in holistic veterinary medicine. I'm certified in veterinary acupuncture, veterinary food therapy, as well as veterinary physical therapy for all kinds of critters. So I do a lot of the holistic medicine, more Eastern medicine, as opposed to traditional Western medicine. What that really means is I did go to vet school for 4 years. I'm very, very much into research and constantly learning and taking these courses and trying out new and different research ideas. And so I kept going after that. I went on for a rotating specialty internship, loved it, decided to keep going, and went back to school 3 more times to travel down the path of food therapy, acupuncture, physical therapy, and more. And I absolutely love what I do each and every day.
Awesome.
Sorry about that.
So tell us a story of how Jessie became Dr. Jessie, the vet.
Yeah, so I definitely was not the typical veterinarian. I didn't want to be a veterinarian since I was really little. I kind of just knew I liked animals. I knew that I really, really liked science, and I needed to find a path in there. So in undergrad, I wanted to go actually to PhD school, and to PhD.
Okay. And what kind of program?
Epidemiology.
Okay, so population study and statistics and all that.
Absolutely. So very much research based. And so I had everything set up to go get a master's, continue on to get a PhD, and I realized what I really wanted to do was go volunteer again and again at the Lion and Tiger Sanctuary down the road. And so I quickly realized that I wasn't in the right place and decided to go down the path for vet school, which means I had to go back to school again for another year. But I love learning, so for me it was just a longer journey to get to where I wanted to be.
Wow. Yeah, cool story. So basically you were an animal-loving nerd and decided to take a detour away from statistics and go down and work in a sort of setting where you could have your hands on animals on a daily basis.
Exactly.
So what was the story of being in traditional veterinary medicine and the journey toward holistic veterinary medicine? Was that kind of a conscious choice, or was there some, spark or story that led to that?
Actually, it's about my first dog, Duke. So Duke had a very, very rare type of liver cancer. Of course he did. He's a veterinarian's dog, right? They always get the weirdest things. And so he was diagnosed, and I called every single specialist on the topic. I even called a few in Germany and Southern England, and they all told me that you got the diagnosis, you're doing everything possible, there's nothing left. And I didn't want to accept that because I loved him and he had good days, but he had bad days, and I wanted to do everything for him. And a colleague actually told me to go down the hall and speak with the acupuncture vet. And I'd never been exposed to those therapies before. And so I figured, okay, let's try this. And I took him, and within 2 treatments, he was a puppy again.
Wow.
And after that, I was hooked. After that, I said, what do I have to do to learn all this? Where do I have to go? I need to do this. I need to help pets in this way. This is unbelievable. We did everything Western, and Duke didn't improve very much. But the second we incorporated holistic and Eastern therapies, I had my dog back.
Wow.
So, yeah.
So when you say you weren't exposed to that in traditional veterinary, can you say more about that? Like, you didn't even know that it existed, or they do or don't even mention it in school? Or
there are only 28 vet schools in the US, and only a handful of them have that department or that specialty. So I went to North Carolina State for graduate school, and we had a rehab department, but we didn't have anything relating to acupuncture, herbal medicine, anything like that. So I had no idea it existed.
Wow. And so after 2 sessions, I mean, what did they actually, physically do in those 2 sessions, without going too deep into acupuncture? And I mean, they opened up a couple meridians. I mean, what was done?
So he got 2 treatments dealing with trying to fight inflammation within the body, as well as stimulate appetite and promote energy. And so for, I could say the Chinese terms, but basically those were the main principles to go by. And he responded amazingly. And I got 2 more years with my dog. We added on other things, of course, but 2 more years when I was told 6 weeks.
Wow. And how old was he at the time again?
He was 13.
So he was 13 when he got liver cancer?
Yeah.
And lived to be 15?
Yes.
Wow. And what kind of breed again?
He's a Cocker Spaniel.
Cocker Spaniel.
Yeah.
Wow, quite the story. So what is the actual path someone goes through from, once you've been in traditional veterinary medicine to becoming a holistic vet? What does that, walk us through that process?
Yeah, so a lot of it is going back to school. Depends on where you'd like to get trained or what you'd like to pursue. And a lot of it is very much research-based. You have to want to learn more about what can help the pets. You want to be a part of the American Holistic Veterinary Medical Association, the Herbal Society, all these different groups that kind of help you bolster this repertoire that you wouldn't have just graduating from veterinary school. You need to pursue other paths and other areas to really become a holistic veterinarian and know everything you can know. So for me, I went to the Chi Institute to learn a lot more about herbal medicine, acupuncture, as well as food therapy. And then I continue to constantly go to different continuing education classes when I can, different conferences. But it's a lifelong journey to really educate yourself and get to know everything you can for your patients.
So now the Chi Institute, is that an institute that is focused on holistic or on Eastern medicine for animals only, or simply the principles of Eastern medicine for any mammal, I guess, or animal?
Oh, you could treat anything, I would say, based on the principles and the training. It's Traditional Chinese Veterinary Medicine Institute. Okay. And it's awesome. I actually teach there as well, and I love going there every time.
And where is that geographically?
So it's in Reddick, Florida, really close to University of Florida, Gainesville.
Okay. And the courses are, it's not necessarily just animal focused. People go there to learn about TCM, traditional Chinese medicine, for human.
Oh no, it's only for veterinarians.
It's only for veterinarians.
Mm-hmm.
Okay.
Yes, very much focused just on that area.
Okay. So what is different about an approach for a human versus an animal when it comes to TCM?
It's really hard for me to say because I haven't taken any human courses.
Okay.
I very much like the pet aspect. I get asked by a lot of my clients, when are you doing acupuncture on me as opposed to my dog? And I always say, no, I'm trained and certified for your pet. I've got, you don't want me doing acupuncture on you, but thank you.
Yeah, there are better people for that.
There are way better people for that.
Interesting. So, being a holistic vet, how would you say that your mindset differs from a traditional vet, and or how your mindset differs, Dr. Jessie, the traditional vet versus Dr. Jessie, the holistic vet?
Yeah, so I think the way I would look at it is I absolutely agree and love Western medicine. I just choose to specialize in Eastern therapies. So when I look at a pet, I very much try to treat their underlying pattern, or perhaps they're basically the source of all the issues versus just looking at their clinical signs and just having a typical Western diagnosis. It's a very different approach, but I fully appreciate and utilize Western medicine every day.
Mm-hmm. Yeah, it's almost, the extent of, maybe Eastern, this is just, my perspective, knowing very little, not being trained, is Eastern medicine tends to view the body more as a complex ecosystem or organism with lots of different, interdependencies and lots of different variables, whereas Western medicine is much more mechanical and single cause and effect type of approach. And so if, of course, if your dog gets hit by a car and needs, its bones put back together and joints put back together, that's certainly more a Western medicine approach. Acupuncture is probably not going to fix that. It might, help with creating an overall healing state, it seems like, et cetera, but not actually going and mechanically putting things, back together again is how I've always thought of it. And that might be, overly simplistic, of course, but
no, I think Badger agrees with you. I do think there is a time and place for Western medicine, especially emergency medicine. I can't replace that with Eastern medicine. There's no way I ever could. There's a place for both, and honestly, I think integration of both is essential for any pet. You should have the best of Western medicine and the best of Eastern medicine for your pet.
Mm-hmm. So in terms of your patients, to what extent do they come to you kind of on a recurring basis just for, a general refresher and rebalancing, versus coming for a specific issue versus being referred from a traditional vet?
Sure, it really depends on what I'm seeing the pet for. So I will see that a lot of the pets I see for pain management, whether it's arthritis, hip dysplasia, elbow dysplasia, or just the older population that has trouble getting up and down, and just the owners want to maintain their independence and their mobility. So I might see one kid twice a week, and then we'll try to space out the appointments or the therapies depending on how they do. I might see a kid once a month, and that might just be a tune-up. How are we doing? Mm-hmm. Okay, we're noticing XYZ. Great, that's what I'm going to focus on for this treatment. Let me know how we do. I expect you in 4 weeks. If we need to see you sooner, we can.
Mm-hmm. So what are some of those initial issues or problems that patients are coming into you with for the first time? And maybe they've always gone to their traditional vet and now they're coming to you. What are those usual kind of trigger issues that get them to say, yeah, I want to try something different this time?
I would say almost everything that I treat has a basis in underlying inflammation. So at South Florida, I'll see a ton of dogs or cats even, that have skin allergies. And the owners have tried everything under the sun, and they're coming to me as either a last resort, or they just heard about how great holistic medicine can be and they want to try it. Mm. I also see a great majority of orthopedic and neurological cases. Mm. Electro-acupuncture can do wonders for kids who have any type of neurological issue. It's absolutely amazing to see the research on things like herniated discs, and even just pain management. It's astounding. And what's nice is, my goal personally is to eventually get them off of any type of pharmaceutical that long-term they just can't be on for liver or kidney issues.
You're calling them kids. Can you say more about that?
Yeah. So for me, I, chose this career path, and it's very much part of my life. It's my life path. And any pet I see I consider my pet. I consider my kid, in one sense or another. So when I get to see my kids at work, it's a great day. I love to hear about how they're doing. I love to see their progression, and I love to tailor their own treatment plan just for them.
Got it. Now, when you talk about the skin allergies, for example, so let's say a cat or a dog comes in with some skin allergies. What are the first 5 to 10, 15, 20 minutes and the whole session look like for a typical case?
Well, my clinic's a little bit different. So we spend a large amount of time with each patient. It's not volume based. It very much is quality care based. So the first 10 minutes of your hour session will be me asking you everything from food to environment to our itchy spots to how we've been feeling post this Western treatment, that Western treatment. How are the other pets doing in the household? What's our environment, our flooring like? Have we had any issues with any external parasites? We go into great depth and really try to flesh out what's worked, what hasn't worked, where do we want to go from here? What's our top goals for our pet? And from there, I can really create an individualized treatment plan.
Got it. So what are some of the red flags that come up in that initial questioning session?
Red flags meaning?
Well, red flag, you mentioned, okay, you'll ask the owner, the pet parent, what kind of food are they eating? Water are they drinking? All these different questions. What are some of those things that your, radar is trying to tune into and latch onto when you're hearing what they're talking about their pets' lifestyle, et cetera?
Yeah. So I think one of the biggest things is if I hear there's fleas in the household. So I'm a holistic veterinarian. I love research-based evidence, and I've been unable to find anything natural or holistic that really eliminates those type of external parasites. Unfortunately, one flea bite leads to enough saliva that you can have a reaction going on for 2 to 3 weeks in a pet, just from one flea bite. On top of that, fleas carry pretty awful diseases that you and I can get. So treating the household, treating your pet is protecting your pet, and it's protecting you. So to me, when I hear that we've got a flea or a tick problem, I have a lot of education to do, not just on the pet side, but on the human side too, because zoonotic diseases are a pretty big issue in that regard.
Interesting. And so a couple questions there. One is you said one flea bite can cause a cascade of responses in the body. Those are basically inflammatory or immune responses? What do you use?
Both. So skin allergies can rear their head in a number of ways. It can be everything from GI related to what you can see as hot spots or frequent recurrent ear infections or skin infections. 90% of our immune system's in our gut. So most allergies can be divided into food, environmental, or both. And it takes time to really flesh out which or both those items are.
So one flea bite could lead to, what's the biological, physiological mechanism that leads like one flea bite to cause all these other potential systems? Like the body's just on high alert and then everything it just reacts to, or?
I think it gets a little bit more complicated than that. You have to go into all the biochemistry of cytokines and interleukins and all the stuff, the horrible stuff that gets released. And, definitely not something like anaphylaxis, but something that's pretty terrible for the pet and you tend to see as itchy signs. Whether it's excessive chewing, licking on the feet, scratching the ears, all that fun stuff can just be related to skin allergies. And unfortunately in South Florida, it's beautiful here year round. So everything's blooming year round. So skin allergies tend to be year round.
Interesting. Yeah. Back to the flea issue. So it sounds like you're despite being a holistic vet who wants to take is as much as possible taking a natural and non-interventionist approach or non-chemical approach to things, it sounds like when it comes to these external parasites, sometimes more aggressive chemical spraying type of options are actually the type of path that you recommend, or am I reading into that, or what's your
No, you're correct. I think we are lucky that we have anything that gets rid of these external parasites. It's really scary. Heartworms are really common down here. Our mosquito population's out of control. If your pet develops heartworm, meaning dogs as opposed to cats, I have to administer something called melarsoline to try to get rid of that heartworm.
Mm.
There's nothing else I can do. If we don't treat for heartworms, there's a very high risk that your dog could die. It's even worse in cats. If you don't provide prevention against heartworms, there's nothing I can do if they get infected. We have no cure, no management, no anything for cats when they're heartworm positive.
Wow.
So the way I kind of look at it is, aren't we lucky that we found something that works? Granted, it's not my favorite, but we're very lucky that it's out there, that we can have this opportunity to protect and help our pets. It's not my favorite thing, but I'm pretty grateful that it's there.
Right. So, dogs that have skin allergies, especially golden retrievers, I mean, we're coming out with a new product that is designed to kind of specifically support the skin allergy response. What beyond the external parasites, fleas, ticks, etc., what might a treatment look like for a dog that's got some major skin things going on?
Yeah, it really depends. I think the first thing I try to target is food therapy. So is it really environmental, or is it something more food proteins not being great with our gut system, so our immune system flares, and that's what you're seeing, all the itching and the scratching. I also want to know how we're taking care of our coat and our environment. Sometimes these pets or these patients are super, super allergic to dust mites. How often are we cleaning? How often are we getting external allergens off of our skin? Are we bathing once a week or once a month? Or even that, because that's a really quick fix for a lot of pets. I also really, really like omega-3 fatty acids. They're great for skin coat health, as well as heart, as well as joints. So I've seen a dog's entire skin coat improve just from adding omega-3 fatty acids. It's something you and I should be on, as well as all our pets.
Sure. Yeah. That's one of those ingredients we've gone back and forth a lot on because, knowing the nutrition industry like we do, there are good sources, bad sources. And, it's hard because any omega-3, regardless of where it comes from, is likely to have the sort of positive effect that you're talking about, right? But unfortunately, in the industry, you have a lot of toxins that many of these ingredients aren't necessarily, tested for. And so the long-term chronic exposure from that is potentially a bigger issue. In terms of skin allergies and on the food topic, what are some of the usual triggers that you see or look for?
Triggers meaning,
I guess, are there some common out when you have dogs that have skin issues and you feel like you've zeroed it in on an actual food? What are some of the more common reasons that a food might be causing that, and or what is in the food that you might suspect?
Yeah, so research has shown that it tends to be protein based. So I'll say most of the poultry flavored or poultry based diets, I see a ton of flare-ups and a ton of skin allergies. When you go more towards novel proteins, I see a great improvement. Personally, as a holistic vet, I love home cooked food. I think it's awesome for our pets. There are several companies I absolutely love that have worked with a veterinary nutritionist to make sure everything is balanced. Unfortunately, in the food industry, there's almost no oversight for pets as opposed to humans. So anybody can make anything, and it doesn't have to go through any regulation. So it's really up to the consumer to speak with their vet and do their research before they start their pet on anything.
Yeah, it's definitely a little bit of the Wild West in terms of the food side for pets, and even more so to a degree on the supplement side. Thankfully, the National Animal Supplement Council is doing a lot. Bill Bookout and his team, and we're a part of that. We've gone through that whole entire process, and knowing things on the human side like we do, we're actually very impressed with the process that they have in place. In many areas, it's actually better than the human side of things. So, anyone listening, highly recommend that if you are getting supplements, that you ensure they've got the NESC quality logo on there. We're in the final stages of the process, so it's not on our first batch of product, but we'll be moving forward, and we've gone through all that process.
That's to be commended. That's amazing.
Yeah, it's definitely a longer, harder path, but we feel for sure like it's the right one, and very impressed by them. So I learned recently about, and this came from my first guest, Denise, in terms of you were talking about proteins. And so from a traditional Chinese medicine perspective, you have warm, neutral, cooling meat. Can you talk about that?
Very good. Yeah, so every food, I know this is going to sound weird, every food has different energy to it, right? So it has either warming, cooling, neutral characteristics. It just depends. And a good way to think about this, I know it doesn't sound typical, is when you're sick, what do you want? You almost always want chicken noodle soup. Well, why do you want that specific protein source? What about it? Chicken's actually extremely warming, right? So it's wonderful to have when you're cold and you're sick and you're not doing well. If you're outside and it's super hot, what do you tend to see everyone have at a family barbecue or anything like that? Watermelon. Watermelon's exceptionally cooling. It's what you're going to want when you're outside and overheating. So that's a really important thing that I use when I counsel owners on nutrition and try to see, is this a yin or yang deficient pet, which is basically hot or cold, and what would be best for their underlying pattern and the source of their problems.
Okay. So can you be specific at all in terms of what meats, what types of proteins tend to be warm, neutral, cooling?
Sure. And I'm probably going to do a blog on this in the future because I get it asked so often. There's great food charts about it online, but for example, if you want something that's very warming or yang flavored or in that vicinity, you would go for something like venison, or chicken, super, super warming. If you want something very, very cooling, you're going to go for more rabbit or cool deep water fish. Those are just naturally cooling and can really help your pet when they're very, very much heat seeking. Mm-hmm. Almost all the pets down here are cool seeking because it's so hot all the time. So for them, they're looking for the cool bathroom tile. They're looking for the cool floor. They're not sleeping on the nice bed their parents bought them. They want the tile.
Interesting. So when you say, so what's yin is cold and yang is warm? What's the?
Very good.
Okay.
Yeah.
So.
Well, deficient. When you're yin deficient or yang deficient.
Okay. So, all right, now I'm confused. But either way.
I'll send you the articles.
A dog comes in and you determine that they are yang deficient.
Okay.
Which means they need warmth? Yes,
so they are lacking warmth if they're yang deficient. You could say that every cat you meet is very.
Before that, though, how do you determine that?
So it depends. A thorough history really helps. Finding out what they seek at home, if the owners have noticed that they really want to be on that cool tile versus that very expensive bed they bought them, as well as a tongue and pulse diagnosis help. And tongue and pulse.
Tongue and pulse, got it.
Yes, so that's where you get into traditional Chinese veterinary medicine and the base of determining what their underlying pattern is.
Interesting. Yeah. So when you get a lot of your videos and courses going, will you be going through kind of a lot of these things, and not that people should be diagnosing their dog on their own, but at least you're kind of sharing and helping them understand kind of maybe what to look out for, and then can, from that, seek a little bit more professional guidance. Are these the kind of things you'll be sharing in your online videos?
Yes, exactly. So my goal is to really empower clients and owners to treat their pets from home. I think there is a lot you can do at your home just based on food therapy as well as acupressure. And that's really the goal of me starting my online courses, is to help owners help their pets at home. And, of course, I still want you to go see your veterinarian, especially in regards to any type of medications or anything like that. But food therapy is doable from home.
Interesting. And so food therapy and acupressure are the two that you will likely spend a lot of time in the courses on. Can you talk about acupressure a bit?
Yes. So acupuncture is obviously the placement of needles at very, very precise, specific points to stimulate changes within the body, basically to ask the body to heal itself. I would like to generate courses to teach owners to do acupressure, which is as effective as acupuncture. It just allows anyone to perform it. It's very, very rigorous and very difficult to go through an entire acupuncture course and learn the anatomy of all the animals, right? So for a veterinarian, it's 5 years of hard study. I think that's a lot to ask a client or an owner, but I think it's doable to ask them, look, I'm going to teach you this acupressure point, and I want you to go ahead and practice that on your animal 2 to 3 times a day. Let's encourage their body to heal themselves. This also helps me space out their appointments so we can, keep the treatments going and make it financially manageable for you.
So what's an acupressure? I guess maybe one of the more common acupressure, moves that you do yourself that you could possibly describe verbally that an owner might be able to just go and try right now. Is there anything like that?
That was great. What are moves in acupressure?
Yeah, I don't know.
So
back to wrestling or jiu-jitsu or boxing or something here, but not the right word.
So I'll use this. One of my cat's favorite toys.
So we're looking on video now. So if you're watching on YouTube, you'll see this. Listen, go to YouTube. So you have a little pet, looks like a cross between a cat and a deer.
Yeah, it was something, but they got to it. But the best thing to know about this, and obviously I'll explain it out loud, is I would focus on, let's say, stomach 36. That's a very, very powerful acupuncture point. So in times of war, people would actually needle stomach 36 on themselves so that they could fight and walk another 3 miles in battle. It was called the 3 mile point. So it promotes a lot of energy release. It really is really great for a lot of my cancer kids because that's the main thing we're monitoring. How's their energy? How's their quality of life? So I will teach my owners to press on stomach 36 to really stimulate that point. So you can find it on yourself or on this pet just by finding the knee joint, going just distal or below where you're on your tibia, and then pressing on the front part of it.
So my knee joint, like my kneecap?
So below that. So you want to go to your knee.
So that kind of soft area that, so below that. Below that. Got it. So there's a tendon there. So underneath that?
Yeah, underneath that. That's your patellar tendon, right? Okay. You want to go just below that. You'll start to feel your tibia. You're going to go medial or towards the midline of yourself, and you're going to press there.
Toward the midline being?
Towards your nose.
Towards my nose. So basically pressing kind of like up, sort of. Yeah, there's kind of a little tender spot there.
It is tender. It's very, very tender.
So that's when you know you got it.
Yes. So it has a different sensation than I would say going to the right or the left of that spot.
Yeah.
For me, it's a really strong point when my acupuncturist needles that point. It will definitely keep you awake and give you a lot of energy for a long time. And so it's, acupressure is something that anyone can do from home, and it can really help your pet. And I think it's great to empower people to have that opportunity.
So you do that on both knees?
If you can. It really depends on the pet. I know for my cat, for example, he'll let me do it on one leg, but he won't let me do it on the other leg.
I was referring to, I forgot we were doing a dog podcast here and was thinking to myself. So on a dog, it would be their front legs?
No, it'd still be their back legs.
Back legs also.
Mm-hmm.
Interesting.
Yes.
And
I promise I'll send you a picture.
And how long do you hold the pressure for?
So ideally, we hold 5 to 10 seconds, but every pet's different, right? Some pets are going to love that point, and they're going to press into you when you do it. And you're going to be holding it for 30 to 60 seconds. Some pets are only going to allow 5 seconds. It just depends on the pet. It's the same things with humans in acupuncture. Some people don't need that full 30 minutes. They want 10 and they're good.
And so you might hold it there for 5 to 10 seconds, a few rounds of that, kind of depending on how the dog reacts.
Correct.
Wow, interesting. So that's a good example of acupressure and something someone can do at home. Back to the food therapy. Should we go down this rabbit hole of dog foods that, commercially available dog foods? I know you mentioned home cooked, right? So, well, actually, I did have one listener who specifically asked, what's a great home cooked recipe? Ask the holistic vet that you're interviewing, what's a great holistic home cooked recipe? Because I'm running out of recipe ideas for my dog.
Yeah, I think it really depends on the pet, right? So I can tell you that when I formulate home cooked diets, I always work with a veterinary nutritionist. They've gone to vet school, and then they've pursued a residency just in nutrition for pets. So they're really, really good at making sure everything is balanced. That's the biggest fear that I have when it's home cooked. Is it balanced? Is our calcium and phosphorus exactly where they need to be? Because if they're not, we're going to have issues. And using eggshells doesn't always work the best for calcium and phosphorus sources. So, it really depends on that owner and kind of what they're looking for. I love working with a veterinary nutritionist and having everything measured down to the gram or the cup. If not, then I have a few food companies that I love where I've already met with their veterinary nutritionist and love what they've done with the recipes and how they formulated it. And they've made it really easy to ship frozen to the house, thaw it out, feed it to your pet, warm it up, and it's super, super easy, and it's balanced and safe.
And what is so important about calcium and phosphorus?
Calcium and phosphorus can kind of make the world go round for pets. You've got to make sure that we've got adequate bone growth, that we're not lacking those nutrients, because then you end up in really, really bad developmental disorders, and some pets can't recover from that. So that's always my biggest fear when we've got home cooked diets. We have to do our due diligence to make sure that it's balanced and safe for the pet, or you will have issues down the road.
So what else makes a diet or a meal balanced for a dog?
Oh boy, all the fun minerals and vitamins and everything that come into play. Calcium and phosphorus are the two I worry the most about, because unfortunately I've seen things go south where they weren't added adequately, and years later we're seeing the issues on the bone. Other things are going to be things like magnesium, total kilocalorie count can make a big difference. It just depends on the pet.
And what about balancing from a macronutrient perspective? Protein, fat, carbohydrate, and or muscle meat versus organ meat versus bone, that kind of.
You make an excellent point. So that also depends on the pet. If you're a diabetic, you want more proteins versus carbohydrates, right? If you're trying to lose weight, you want more fiber as compared to other things. So it just depends. I do have some clients that feed raw, and we have lots of in-depth conversations about that and the precautions to take and things like that. Everything is different. I don't think there's a set path for any one pet. There's kibble, there's home cooked, there's raw. It just depends.
Yeah, that's certainly my philosophy is, you've got to figure out what works best and, inform yourself as much as possible, make the best decision you can. And then most importantly is, the being empirical about it and seeing how your dog actually reacts. And that's probably seems like it would be the most important thing. When it comes to raw feeding, what's your thought on that? Well, actually, let's hold raw feeding and kibble.
Okay.
First of all, what is kibble? Is there good kibble? Is there bad kibble?
Yeah, so we made kibble. Kibble didn't exist in nature. So we made it. A lot of the big name brand companies like Royal Canin, Purina, stuff like that, have specialized in kibble because it's very easy to produce. It's high in carbohydrates, so pets seek it out, right? There's a lot of stuff you can get at Publix that's pure kibble that I call kitty crack or dog crack, because they absolutely love it because it's so high in carbohydrates that it's just like, yes, I love this, tastes great. What worries me is that it's not really natural. We made it, and it's very, very processed. Very processed, and that's the only way they can get those cute little colors and shapes that we love. Our pets don't care, but we think it's great.
Right.
And so I kind of look at it, and I've seen pets improve so much just by having human grade quality food. they're totally different. Their GI symptoms go away, their behavior problems go away. They're an entirely different and improved pet.
Mm-hmm.
And all you did was feed them food as good as what you're eating.
Yeah.
That's all you did. There was no magic there.
Yeah, so the whole industrialized food complex has definitely seeped its way into our dog food as well, unfortunately. I remember we fed Sunny, I get it at, I think it was Lucky or Safeway back in California. I don't even know if, I think Safeway's still around, but I don't know about Lucky. It was a big 40-pound bag of Purina dog chow.
Yep.
And I didn't know what ingredients were. I was like, hey, this is dog food. Someone must have decided it's good for dogs. And I went on their website and looked at the ingredients again, and it's like the thing hasn't changed in 20, 30 years. The first ingredient is still, was it whole grain corn or wheat?
Yes.
The ingredient in highest quantity in this product is wheat or corn. It still just, blows my mind. And then I started researching more about all these foods and getting into meal and meal byproduct and what that actually means. And that's a very frightening thing. So
I think it's interesting we invented that word.
Yeah.
We didn't say what it really was. Yeah.
Interesting. Okay. So are there any kibbles that are Dr. Jessie approved?
Well, I never want to say approved or anything like that, because it can be really, really hard to get your pet off that. Maybe that's the only thing they do well on, because now their GI system has accommodated for that and they won't accept anything else. Everything is very much individualized. Or if I have an owner where there's financial restrictions, this is all they can do for their pet. Okay, then we're going to work with you. If we do kibble, then can we do a top dressing at least? Can we try to get some home cooked quality foods as a top dressing according to that underlying pattern? Great. If we can do that, then I'm happy. Let's see how your pet does day by day. Mm-hmm. There's no, one kibble or anything like that I really seek out. It just depends on the pet.
So let's say someone out there is, they don't want to go through the hassle of making something home cooked, or they don't really see the benefit, or their dog is doing fine on kibble. So why change? I don't want to change what they like. And you would suggest some sort of a topper. What's an example of a topper? Let's say it's 50-pound dog, German Shepherd, Golden Retriever, medium size.
So I love toppers like bone broth. I'll have my owners cook bone broth from scratch, and they can even keep some for themselves because it's great for humans as well. I'll also recommend things that are very, very high in antioxidants, blueberries, kale. If you can at least do boiled chicken breast or hard-boiled egg, let's go ahead and add that in. These are things that don't sound like a big deal, but are pretty big for any type of pet, just to get them nutritionally where you want them. And so I'll always work with the owner to try to achieve what they can do. Because if you've got a lot of pets or you've got other priorities in your life, you've got to make sure it's doable for the owner.
Mm-hmm. What are some of those antioxidant-rich foods that are compatible for dogs? You mentioned blueberries. Could you do raspberries or apples or bananas? I mean, are there any, definite no-no vegetables out there to avoid?
Yes, there are a lot of no-nos out there. If you're ever curious, like, what don't I feed my dog? You can go to ASPCA Poison Control, and they've got lovely infographics and stuff like that about don't you dare feed this.
Like chocolate.
Like chocolate. Don't do that. Other things that a lot of people don't know about are grapes. Grapes are actually super toxic. Even one grape can kill a dog.
Wow, and why is that?
We actually don't know what the toxin is in it. We don't know the mechanism. We just know that one, as opposed to a bunch, could potentially kill a dog.
Wow, interesting.
Yeah. So I've had pets come in for grapes or raisin ingestion. Things like that are pretty scary. There's other things down the line, like macadamia nuts aren't the best choice for pets. It just really depends. But it's always interesting to discover, okay, they ate this, let me call poison control and see what we've got on our hands.
And what's your thought on an approach of, I'm just going to give my dog kind of as much variety as possible and not get them so regimented, so that in the idea that, hey, now their system can, adapt and is able to manage, a lot of different things, and maybe their system is a little bit more robust, so to speak, as opposed to a dog who is on the same food for their entire life, and then they lick up a piece of cottage cheese off the floor, and then all of a sudden it's health mayhem.
It's tough. There's not a lot of research on rotation of foods supporting general immune improvement. It's just not really out there. The biggest risk in rotating foods could be setting off allergies or causing something like pancreatitis, because the body just can't deal with it. That's why I think a rotation of toppers, basically small portions of human grade food, is a great idea, right? Because that's minimal financial investment and time investment for the owner, and still getting great benefits for the pet. You can do these great holistic foods. You can do an easy rotation, and it's foods you should be eating anyways for yourself, so your pet just gets some of that. That I would support, and then I think would be a huge, huge help to every pet out there.
Interesting. So what about raw?
Yeah, I knew you were going to talk about that. Raw can be very controversial in the veterinary field. My biggest fear with raw is that there is a documented salmonella risk for a majority of raw products, right? So that's scary, because unfortunately our pets can get it, and guess what? We can get it. And if you have anyone that is older in the family or very young, so a toddler or anything like that, if a dog is eating raw and then the toddler touches the dog's mouth and the toddler touches her mouth, because it's a child and that happens, they're at high risk for salmonella. That's my biggest fear with raw. I do have a lot of patients who are on raw, especially my agility kids. They've been on raw since they were very, very young, and they rotate foods religiously to make sure that we've covered for everything. I think that owners should know if they choose raw, you need to have proper precautions. I require that my clients have a separate sink, a separate wash station, separate bowls just for raw prep and feeding. And I want gloves. I really do. And if there's anyone older in the household or extremely young, you need to take precautions for that, and you need to understand the risks. But I completely understand why some owners choose raw and they want raw for their pets. It really depends. Some pets I have seen better do on raw than home cooked or kibble. It just depends.
And what are some of the potential advantages, pros of a dog being on raw versus, kibble and or even home cooked?
Yeah, so I think the way I personally choose it is home cooked, whether it's by the owner or through a very reputable company that makes sure it's balanced. They ship it frozen, you thaw it, you feed it. I prefer that because I know there's no chance or almost zero chance for salmonella risks. Then if they want to do raw, they can, but I really, really, really push those type of boundaries and the recognition of what could happen if you don't follow those suggestions from your veterinarian. And then, if they want to do kibble with toppings, that's great as well. It really just depends on the pet. My agility kids do really, really well on raw.
And what about some of these raw toppers? They're freeze dried. I think True Dog is one brand. What's your thought on that kind of approach?
Stella and Chewy does a really good job on frozen raw treats and frozen dehydrated food. They do an excellent job with salmonella control and any type of external pathogen control. My fear is if you get it from places or from sources who don't go through those extra measures, because they don't have to, because you don't have to be AFCO approved. You don't have to do the extra processing and the care that you took for your own supplements. There's no requirement. And that bag can look just as pretty as another bag of food that didn't go through as much work. It's on you to do your due diligence to make sure that what you're feeding is appropriate.
Right. Yeah. So you're not kind of in the boat of, raw is good or bad. It's more of, hey, if you are going to do raw, this is what you need to know before you go in. And these are some precautions that you can take. And like you said, you would never say, this type of food or diet is, Dr. Jessie approved. It's more of, what's right for you. And you need to understand the benefits and the risks on both sides.
Yes. And I would say I'm unique in that sense because most veterinarians are very black and white on that topic. And for me, I very much want to figure out a way for what's the best healthcare plan for the pet. If you feel like they improve on that healthcare plan, great. Then let's make sure they're covered from all bases, and let's make sure we're doing it right from start to finish. That's really how I evaluate it.
And why do you think some vets are more black and white around certain foods?
I think that the pet food industry starts in the veterinary field as soon as you walk in the door to vet school. So Purina, Royal Canin, Hills all have a foot in the door, and we're trained from very, very young veterinarians that these are the options that are out there. There aren't any other options. This is what you should know and love, and why wouldn't you use this? They've done documented studies on this. This has shown to improve for everything else, obviously. And so we're never introduced to anything else. We're not introduced to raw in vet school, really, except to say that watch out for salmonella, super, super bad. We're not introduced to home cooked. We're not. So if you kind of look at it from that industry standpoint, that's what you see. If you're looking for home cooked, where do you find it? You can rarely find it, right? There's only a few companies out there who have gained momentum in the past several years. Everything else is kibble in different pet food stores, kibble at the veterinarian, kibble at Publix.
And so what about kibble and grain-free?
Yeah, so
A lot of
there's that's even more controversial. Wow. So kibble and grain-free has been an issue lately. And what's been happening is we've been seeing a rise in a very specific heart condition called dilated cardiomyopathy, DCM, in dogs. We haven't concluded if it's effectively from these grain-free diets, but we're seeing more and more dogs develop it, and it become reversed when we take them off grain-free. So it's all based on the idea of taurine, and they're not getting enough of it, that amino acid that's so essential for the heart to work and function. So when I look at it, I think, the jury's still out. We still don't know. As much as grain-free might help your dog, I'm more worried about it hurting your dog long-term because we don't have the research yet. All we've got is a lot of worries on various name brands that all include the word grain-free. So I wouldn't temper with it. I wouldn't toy with it at this point.
Right. Yeah, it's one of these nomenclature things where, grain-free. So, a raw diet is grain-free. So, someone says, okay, grain-free, it's like this big Venn diagram. The problem that from what I notice, and I'm not the researcher, is that within the grain-free kibble area, there's this little ingredient that dog food companies have put in there in order to boost up the protein content in a very cheap way, and that ingredient is pea protein.
Yes.
And so potentially this addition of pea, either, because it's there in place of other meats, there's less taurine in the product, and or it potentially leaches taurine from the system because it attracts it and binds to it, and that's the result. And it's one of these tricky things that the companies do is everybody knows that the descending order on the product is what's the first ingredient is the highest quantity.
Correct.
So
that's required.
if the company wants beef or chicken or turkey or whatever it is going to be the quantity that is the highest. But they want to have higher protein contents, so they put pea protein in there. But they don't just list it as pea protein. They split it between pea protein, pea flour, pea starch, pea who knows what. And as a result, that just pushes up the meat content. But there's actually a lot, if you added up all the protein content from the pea source, it's actually much higher. And it's a very tricky and misleading thing that I think these food companies have done.
Yeah, and we don't quite know what's happening in the body. We just know that it's affecting the taurine levels. And we know that repeatedly in a large population of dogs, they've all developed this heart condition, right? So what that tells me is we don't know enough. And we know that it's dealing with pea protein, and we know that it's these brands that have manufactured in this way. So I would really stay away from grain-free at this point in time till we get more information.
Yeah. I think it was Dr. Stern out at UC Davis that did a lot of the research on this, right? And it's a big problem for golden retrievers, which is one of the issues that we put a decent amount of taurine in the product, you know, is just an added boost, is almost insurance, so to speak. So yeah.
I think that's excellent.
Thank you. On that topic, what are your thoughts on supplements in general?
I love supplements. I don't think as veterinarians that we're trained or we talk about supplements enough. When I select supplements for pets, it's really based on the quality of that supplement and what the pet needs. A lot of pets, pretty much every pet I see, should be started on glucosamine, type 2 collagen, omega-3 fatty acid, and probiotic. This is just something that all our pets should be on and we should be on. It just makes it better overall for that pet. I see these pets doing better, living better, less chronic illnesses because you're starting their immune system off well and you're starting their nutritional support well. And that's for any pet really. Well, specifically cats and dogs. Exotics can get a little bit different and a little bit difficult to manage with supplements. But for supplements, I really want something that's NAC quality approved, as you said, and has gone through and had research behind it. I am very much research-based, and that's how I select any type of management or supplement care plan for a pet.
And so you feel the literature is pretty solid around those ingredients. You said glucosamine, omega-3, probiotic. I mean, there's a lot of variables there on the probiotic side.
Oh, there's a ton of variables, yes.
That's a jungle in and of itself. But
yes.
What was the other one you mentioned?
Omega-3 fatty acids, type 2 collagen, glucosamine, and probiotic. Those tend to be my go-tos to start with a pet.
Got it. And what's the difference between type 1, type 2 collagen?
It depends on acute, chronic nature, and then what muscle groups you're trying to target in the pet. So type 2 collagen, I'm looking at those arthritis dogs who just don't have the collagen they had before. They don't have great cartilage, period, full stop. Okay.
So who do we have on your lap here?
That was Badger.
Oh, Badger. Badger lap.
Badger, I have animals, obviously. I'm a veterinarian. Badger is called Badger because he badgers you and he loves attention. So the fact that I've been in here and not paying him attention is a travesty to him. I apologize. He's the only animal you've heard say anything because the rest are angels.
Yeah, he's getting a little jealous.
He is super jealous, yes.
So as you know, I'm a big fan of golden retrievers, and obviously I made a product just for them, which some people think be kind of funny, like, that's weird. Why do they need their own product? But that's a whole other angle is, you know, breed specific supplement approach, which, you know, all dogs and breeds are unique. And that's, you know, one reason we did this, but we do have a lot of golden retriever listeners. So first I wanted to start with a testimonial from one of your kids, Ridge, a 13-year-old golden retriever. So here's Ridge's human talking. Ridge, my 13-year-old gorgeous golden retriever, had begun demonstrating trouble getting up and walking around. I sought out Dr. Jessie for acupuncture treatment to see if we could help his arthritis and difficulty moving. Her treatments, along with physical therapy, exercise, and massage, helped my baby walk and run around the house and yard. He now plays with his ball and his younger brother more and is back to his old self. The biggest change I saw is that he'll now trying to get up on the bed with us. Before, when we started treatments, he could barely stand up without our help. I'm so happy to have our dog back. So that was Ridge, the golden retriever.
Yeah, I love Ridge.
What was the story on Ridge?
Ridge was an older kid. You know, he really had really bad arthritis. And on top of that, a large majority of these dogs, I think they develop a peripheral neuropathy that we haven't yet figured out how to diagnose. You can see it as scuffing the hind legs, not being able to transition from sitting to standing very easily, tripping over things when they used to walk just fine. And Ridge was demonstrating those clinical signs. And, you know, and when, you know, I met Ridge, he was the sweetest man. And, you know, Goldens, I think, are heart dogs. They're soul dogs. They very much just meld with your soul and make you want to be a better person, for lack of other words. I know that sounds corny, but it's true. And Ridge needed help. And I saw him from a holistic standpoint and saw that he needed help neuromuscularly as well as orthopedically. And so we started the journey of acupuncture, herbal therapy, and physical therapy. And he did great. He did phenomenal. dealing with all of those modalities and really getting his mobility and independence back.
Hmm. And this was when he was already 13.
He's already 13, yes. In my opinion, these kids aren't seniors. They're just distinguished, and they need a little bit more help than they did when they were younger.
I like that approach.
Yes.
So how many Goldens would you say you see in a typical month?
Oh boy. I see a large number of Goldens. So I would say in a typical month, I'll see anywhere from 20 to possibly 30. It just really depends.
So about one a day almost.
Yeah, I see a lot. They're popular down here and they're a great breed.
What are some of the typical issues they come in for?
It really depends. I see a lot from GI issues like irritable bowel disease, all the way to hip dysplasia. That seems to be very, very common, and rupture of their ACL or their cranial cruciate ligament. These are robust dogs that want to keep up with the family and keep moving and grooving even when they need to take it easy, but they don't, because they just want to be with mom and dad and the family.
Interesting. And those ligament tears, is that more common on the hind legs, front legs?
So it's just like ACLs in people. So your knee joint has this very, very important ligament that makes sure the tibia and the femur fit together like they should. But if you exercise a lot or potentially have poor genes, you can rupture that ligament. And when that happens, it's quite painful. My mom has ruptured her ACL and her MCL. She went for gold. And one of our dogs ruptured their CCL, which is like an ACL in people. And so it's quite painful.
Wow. Are there certain, dogs, they jump up on the couch, they run around in the backyard? Are there certain sort of movements that an owner can kind of say, hey, maybe you should stop doing this now that you're 8, 9, 10 years old? Because these are the high risk movements potentially.
I know it's tough. I would say any high velocity movement, like jumping on and off their bed, is when I tend to see it, or when they're chasing after something, when they go from 0 to 100, going after that squirrel, going after that bird. That's when they get hurt. Mm-hmm. And so I counsel my owners, I'm seeing your first dog for this. I really don't want to see your second dog for this. So let's start training them not to jump up on the couch. Mm-hmm. Let's start using a ramp. Let's start using a ramp for the bed or stairs. And, it's okay. It's going to hurt you a lot more than it hurts them.
Mm-hmm. To what extent do you notice certain issues more with Goldens than other breeds?
Goldens, for some reason, I see a ton of hip and elbow dysplasia. Goldens and German Shepherds, I see that far too commonly.
Hmm. Yeah. And so what can someone do to, maybe, I hate to say the word prevent, but, at least minimize the chances of that happening, or to what extent you feel it's genetic?
I think there is an underlying genetic component that's been proven, but I think there is a strong environmental component too. You should be keeping these kids on an excellent supplement plan. You should be keeping them on a stellar nutrition plan, and you should be keeping them on a really good body weight, because that's what it comes down to. Every extra pound on your kid just kills their joints, just like in humans. So you need to watch those things. There's a great study that took a litter and they tracked them throughout their lifetime. One of the pets part of the litter was free fed. They could eat however much they wanted, right? So of course they went to town. They could get whatever they wanted, what Badger dreams of. And then the other half was kept slightly underweight, right? The slightly underweight population lived on average 2 years longer than their fatter counterparts. So I tell my owners, that's 2 more years with your pet. Who wouldn't want 2 more years with your pet just by keeping them at a healthy body weight?
Yeah.
It's really empowering to know that you can provide that for your pet.
Are you familiar with the Golden Retriever Lifetime Study?
Yes, by the Morris Animal Foundation. Yeah, of course.
Yeah. What's your thought on that study, and what's going on with it, and or the potential impact of it, how it might impact your approach, et cetera?
I think it's brilliant. I wish more owners got involved, and I wish they did it for more breeds. It takes a look at nutritional, genetic, and environmental factors across the lifetime of a Golden. And what's nice is that it relies mostly on owners. You can use your veterinarian as well, but most owners will move within their lifetime, which means you're not going to see the same vet. And it allows you to track everything. And you're basically creating this giant data pool to analyze why is this happening to my golden? What are the risk factors? Are there genetic factors for this condition? It's brilliant. I wish we had more breeds that we could do it on.
Yeah, I mean, it's an epidemiological study, right? So that was
yes, right up my alley.
Right. On the Healing Paws website, you talk a bit about some cancer treatments. Can you share a bit more about what happens when a patient comes in and they have some form of cancer? What that approach looks like?
So for cancer, I either see them as sole treatment or as part of their integrative treatment. A lot of the kids I see are also on chemotherapy, and there's great research showing that acupuncture can keep their red blood cell and their white blood cell at appropriate levels during the chemotherapy. If their levels drop, they can't receive the chemotherapy. There's great research to help that. In addition, you can use it to fight nausea. You can use it to increase appetite, to stimulate the immune system to fight the cancer. So a lot of the things I really gear towards depends on what they're already incorporating to their current treatment plan. No matter what, I'm going to talk about food therapy, herbal therapy, and acupuncture. The latest therapy that I've been researching and incorporating into the practice is ozone therapy. And it basically allows me to deliver high amounts of oxygen into the bloodstream to kind of help detoxify the body as well as fight the cancer, right? The more your mitochondria receive oxygen, the better they function, better your body functions overall.
Interesting. And that, you mentioned about that being in more popular in Europe, is that right?
Yes. So I look at Europe a lot for holistic therapies. And the reason is that they're a lot more open to it. It's a lot more respected there. It's a lot more researched there. Big Pharma is not keen on that here. And it's just not performed regularly. We don't have conferences, societies dedicated to those type of holistic therapies. Spain does. Mexico does. They have entire conferences dedicated just to researchers presenting on that topic. So I have to go abroad to learn more about different therapies. And I find it as a challenge, but I accept it and I want it for my patients here. So I'll call over there. I'll try to talk to veterinarians who are doing these therapies and see the results and get the conference proceedings. I want this for the kids here.
Wow. Yeah. Sometimes the U.S. has a ways to go on certain things. Okay. Yes. So one more question kind of around, holistic treatments, et cetera. And then I want to kind of close up and wrap up with, what you'll be doing on your website and what, dog owners might be able to, learn and gather and be able to follow you in terms of all the great content, videos, et cetera, you'll be sharing. So a friend of mine recently talked about, the idea of, she was sharing the story of how, her friend's dog had always been super healthy. And then all of a sudden her friend started coming under all kinds of stress, work-related, relationship, family, all kinds of things all at once. And all of a sudden the dog started getting sick and experiencing a lot of stress-related issues. So to what extent is there, and/or do you notice stress transference from human to pet?
I see that day in and day out, especially if the family loses a family member or they lose another pet. You have to imagine that for the pet, you are their world. It may not be true in the reverse sense, but it is for them. The lifetime of a pet is not that long, and they wait for you day in, day out, and you are their main motivator for the most part. Mm-hmm. So imagine that gap in their life. They're going to feel it. Imagine if their world, you, is stressed out. They're going to feel it and notice. Pets pick up on a lot more things than humans do, and that's why you see them having great strides, and you see them in different fields where we use them to detect cancer, detect bombs, detect all these things, because they notice more things than we do, and they've got higher senses than we do. So I do see that a lot, especially when they lose a bonded pair, as I call them, animals that have grown up together in a household together. If you lose one, the other one does tend to get depressed. Mm-hmm. If you've got an owner that's been especially stressed out, it's pretty common for the pet to develop a new chronic illness or something like that.
And to what extent do you notice any, I don't know, correlation or linkage between the human's personality and or their, you know, I don't know what you'd call their energy, and the dog, or, you know, pet in general? Like, do you?
Well, that could get me into trouble.
You know, sometimes I hear people start to actually look like their dogs, or vice versa, which was an interesting thing once. But anyway, what's your thought on that, that personality?
I do think that people's personality traits come through in their pets. I do think that if you're very type A and a little more neurotic or orderly than you probably should be, you're going to see that in your pet. They pick up on things. They notice their environment. If you're constantly doing the same thing multiple times, they might notice that's the way it's supposed to do. That's the routine. Pets love routine, and that's your routine for them. So they're going to pick up on it.
Interesting. Yeah, I did a full episode talking all about the Golden Retriever Lifetime Study, and I thought it would be a super interesting data point for them to have, you know, whether it's a personality test of the owner or something else, you know, like the Ocean personality test or something, that at least is a data point around, you know, what is this human's, what are they like that potentially is influencing, and right, like to what extent there's correlation between, you know, different risk factors in that. I thought that would be a super interesting data point, and I don't know, I feel like it should really be in there, but that's just me.
You could even make it more complicated when you have multiple pets.
Yeah.
And who's their person.
Yeah.
But you might have to forgive me because my battery's about to run out and it's blinking angrily.
Uh-oh. Oh, okay. Well, we'll wrap it up here. So what can we expect from you at jesspetvet.com in the future?
Yeah, so I'm working on acupressure courses and food therapy courses. So basically teaching you how to perform acupressure on your pet from home, as well as the best foods, nutritional tips, and home cooking for your pet. And that will be on jesspetvet.com, as well as my clinic website, www.healingpawsfl, like Florida.com.
Okay, so that's jesspetvet, jesspetvet.com.
Yep.
All right, Dr. Jessie, anything else that you'd like to share with our listeners before we sign off here?
No, it was very fun. Badger says thank you.
Yes.
And look forward to talking with you guys in the future.
All right. Thanks so much, Dr. Jessie.
No worries. Bye, guys.
Bye.